Good afternoon, Atlanta Rotary. Welcome, everyone. Hope you had a wonderful weekend, and thank you for tuning in today. We have a fantastic program in store for you today, and I'm pleased to kick us off by welcoming Dr. Beverly Daniel Tatum to the stage. Dr. Tatum is going to lead us in our invocation and pledge of allegiance. Hello, Beverly. Good to see you.
Good to see you, President Catherine. Thank you.
Absolutely. Enjoyed your piece recently in our newsletter celebrating Black History Month. That was a very thoughtful essay, and I know you will kick us off on a similar thoughtful note this morning. So thanks for being here.
My pleasure. And when I was asked to lead the invocation today, I was thinking about the fact that it would be February 28th, which is the last day of Black History Month. And I wanted to lift up the words of Black history maker Howard Thurman, considered by many one of the leading theologians of the 20th century. But then, of course, I was thinking, as I know many of us are, about the situation in the Ukraine and the state of the world, and wondered if Dr. Thurman had words of wisdom for us in this time, and came across this short meditation, which I'd like to use for today's invocation. It's titled, "To Overcome Evil." I seek the strength to overcome evil. I seek the strength to overcome the tendency to evil in my own heart. I recognize the tendency to do the unkind thing when the mood of retaliation or revenge rides high in my spirit. I recognize the tendency to make of others a means to my own ends. I recognize the tendency to yield to fear and cowardice when fearlessness and courage seem to fit easily into the pattern of my security. I seek the strength to overcome the tendency to evil in my own heart. I seek the strength to overcome the evil that is present all about me. I recognize the evil in much of the organized life about me. I recognize the evil in the will to power as found in groups, institutions, and individuals. I recognize the terrible havoc of hate and bitterness, which makes for fear and panic in the common life. I seek the strength to overcome the evil that is present all about me. I seek the strength to overcome evil. I must not be overcome by evil. I seek the purification of my own heart, the purging of my own motives. I seek the strength to withstand the logic of bitterness, the terrible divisiveness of hate, the demonic triumph of the conquest of others. What I seek for myself, I desire with all my heart, for friend and foe alike. Give us all the strength to overcome evil. Amen. And now please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much, Beverly. What perfect and timely words. Appreciate it. Welcome again to everyone. Just a quick reminder to please register your attendance using the QR code that you'll see pop up there on your screen, or there's a link below the video screen if that's easier. You are in for a treat today. We are coming together for the conclusion of what has been a fantastic series on public health and medical issues. We'll begin with a few club announcements and updates. Following that, we have a chance to meet new member Faye Twersky. And then we will bring to the stage a very special speaker. We're extremely honored to have with us a person who has been at the epicenter of an historic battle to beat COVID, Dr. Rochelle Walensky. Dr. Walensky, as you know, is director of the Centers for Disease Control and Prevention, and she will be joining us for a live update with Atlanta Rotary in just a few moments. Following this week's program, I'm also pleased to share that we will return to in-person meetings at the Loudermilk Center. Starting next Monday, we will have a fantastic program on artificial intelligence featuring Dr. Larry Heck, who is an eminent scholar with the Georgia Research Alliance. Just a quick note that Mayor Andre Dickens, whom you may remember was previously scheduled for this date, will now be sharing his remarks with the club on Monday, May the 2nd. I'm also excited to share, by popular demand, we are bringing back the buffet lunch. We'll have a served buffet. We'll still have some individual plates for those who prefer that approach. And then, of course, we will continue to monitor CDC guidance and the City of Atlanta protocols and let everyone know just prior to the program about our final COVID protocols for that coming back together in person. So please be on the lookout for details just prior to the March 7 event. Looking further out, I'm really excited that we have an amazing array of speakers, events, social activities. Atlanta Rotary is in for a fantastic spring, and I could not be more grateful for all the hard work of the club officers, Gina and her team, in putting all of that together. Just a few examples. On March 14th, the Carter Center's Larry Sampler, whom you may remember had led us in the program on the evolving situation in Afghanistan, Mr. Sampler will return to Rotary to share a timely and insightful update on the behind-the-scenes situation in Ukraine. Won't want to miss that one. And also, we have an April series on the supply chain featuring 4 notable CEOs in that space, followed by a Rotary on the Road, which will take us behind the scenes at the Norfolk Southern's new headquarters. On the social front, we have had a tremendous turnout and sign up for our small group dinners. You'll see a quick slide about that. We have about 100 Rotarians signed up to get together during the month of March and April for those smaller gatherings. It'll be a great way to get to know one another better as a club, and a special thanks to those of you who agreed and offered to host one of those dinners. Our Old Timers celebration is also right around the corner. We'll be bringing together all of those members who have been part of the club for 20 years or more. I will remind everyone they are not necessarily old. Hopefully, President Stephanie can rebrand this event next year. The final time to sign up for that event is tomorrow, March the 1st. So please do sign up if you have not done so already and are eligible as an old timer. And special thanks again to Tommy Hills for his fantastic work putting that event together. There is so much more on the horizon. I could go on, but as you can tell, we have a terrific array of events and activities planned. Please join us for each and every one of them, and we look forward to seeing you. If you spent any time watching the Beijing Olympics, you no doubt saw Alana Myers-Taylor, daughter of fellow Rotarian Eddie Myers, all over the media. Alana, as you know, won both the silver and bronze medals in the women's bobsled events, and now has been recognized as the most decorated Black athlete in Winter Olympics history. As we also head into Women's History Month, it was great to see Alana as one of two mothers who represented the U.S. in the Beijing Olympics, and a person who was also elected by her peers to carry the flag on behalf of the United States in the closing ceremonies. So huge congratulations to Alana and, of course, to proud father Eddie. And finally, I'm going to put in a plug for our Trustee Club Handbook. I think I sleep with this thing under my pillow. I know it is such a useful tool for so many club members. You will receive an email tomorrow asking you to update your information. I know Gina and her team are working hard to make sure we have accurate information on everyone in the roster. Please be on the lookout for that email and be sure to update us with any changes in your information so we will know how to reach you. I'm now pleased to introduce fellow Rotarian Bill Bowling, who will introduce new member Faye Twersky. Bill, thank you so much for being with us, for all that you do for the club, and as always, for the wonderful work you do for this community. I will turn it over to you.
Well, thanks so much, President Catherine. Co-sponsors Penny McPhee, the past director of the Blank Foundation, and Dan Gordon, the Javian Group. I'm very happy to introduce our newest member, Faye Twersky. I hope everyone has taken time to read Faye's bio, because you won't allow me to take 15 minutes to read it this morning. And some of you have met Faye at previous meetings. Faye has come to Atlanta most recently from the William and Flora Hewitt Foundation in Menlo Park, California, where she served as vice president. She's now the director of the Arthur M. Blank Family Foundation, and she'll be working with Arthur and the family in defining areas of giving and directing philanthropic resources to the community. Faye also serves on the executive leadership team of the Blank family businesses, and I'm going to ask Faye about this in a minute, including the Atlanta Falcons, Atlanta United, and how about that win yesterday, PGA Tour Superstore, Mercedes-Benz Stadium, Mountain Sky Guest Ranch, Paradise Valley Ranch, West Creek Ranch. Faye, it's a big job. Faye is a highly respected thought leader, author, and commentator on trends in philanthropy. And I can say for us in the philanthropy community, Faye is well-read and somebody that we respect. Faye and her wife Jill have two children, Jazz, who just began rabbinical school at Hebrew College this past fall, and David Nathan, who is a rising third-year University of Chicago student studying biology and aiming for a career in medical research. And let me just say on a personal note, and as a member of the Arthur M. Blank Family Foundation board, Faye has been a joy to work with. She brings a wealth of experience and insight into the work of getting folks aligned and working together toward common goals. And it's that trust building that we will collectively find our ways to meet the challenges and opportunities facing us. And we know facing COVID in the last 2 years, having the philanthropic community step forward and respond to that has been so important. So Faye, welcome to Rotary. We're glad to have you here. And let me just ask, you have worked in leadership roles at other foundations. What differentiates the Arthur M. Blank Family Foundation? Why here, Faye?
Yeah, thank you, Bill. It's great to be here with you today, and great to be in Atlanta. I will answer your question, but before I do, I just want to say thank you to Rotary for having me here. I've been able to attend a few of the sessions, and they've been fantastic. And I've been a fan of Rotary for many years, since I was at the Bill and Melinda Gates Foundation for a number of years, and I got to know Rotary International through the polio eradication effort, which was really impressive, and Rotary was a great partner. So have always been a fan, and just very honored to become a member. What really differentiates the Arthur M. Blank Family Foundation so far, I've been here in this role for about a year. I would say there are a couple of things. One is, Arthur himself, and how unique of an individual he is, both as a philanthropist and as a civic leader. Arthur is how I like to describe him, and I told him this the other day, that he is a very serious-minded, committed philanthropist, and everything that he does, and by extension we do, is also wrapped in love. Like, there's something just very unique about this opportunity that is different from other places that I've had the privilege of working. The kind of the blend of the head and the heart is just a very special sauce.
Well, that it is. And, at the foundation, we're setting out to work on some pretty big problems. Democracy, climate change, workforce development. What do you think are the most vexing problems facing us?
Yeah, that's a great question. They're all vexing. I mean, one of the things that, as you know, Bill, because you're on our board, the Arthur and the family has decided to ramp up its giving over the next decade. So we'll be giving more money away, more funds away in these areas, and they're existential areas. So climate change, democracy, youth workforce development, mental health and well-being. Those are our 4 new areas of giving, in addition to our existing enduring commitment to the West Side and to Arthur's other individual passions. So they are all existential, and they're all vexing. And if they were easy problems to solve, they would have been solved. So I think they're all vexing. But I would say, too, though, that across all of them is the problem of polarization and the crisis of connection in our nation. And that is, to me, the most vexing problem. We can't really solve any of these other challenges unless we find a way back towards more civility with one another, because we're not going to solve these problems just as blue or red or south or north or just the coast or the center. We actually need to find ways to work together across lines of difference to solve all of these other vexing problems. So that's what I would say cuts across everything that we're trying to do, is somehow finding ways to heal this crisis of connection in our nation.
Well, thank you so much. And as you know, that's a core value of Rotary. So what a great place for us to work together. Welcome aboard, Faye.
Thank you. It's great to be here.
Back to you, President Catherine.
Thank you. And Faye, welcome to the world's greatest Rotary Club. It's just terrific. Bill, you couldn't have said it better. Just the words and the spirit of the kind of work that you're doing, Faye, and of course, Bill, also with you always. We are all on such a collaborative path here together. And I liked your sort of existential and vexing problems description, because there are plenty of those to work on. But I do hope and believe that you'll find some of those cross-boundary collaborations with your fellow new members and have plenty of new ways for all of us to work together. So welcome again.
Thank you. Look forward to it.
Great. Thank you. So as you all have seen throughout the month of February, Atlanta Rotary is so fortunate to have among our membership some of the leading global players in public health and medicine. And I'm now pleased to introduce to you today one of those heroes who just joined Rotary really as COVID was hitting its stride. Dr. David Ross is CEO and president of the Task Force for Global Health. His organization is one of the world's leading global health philanthropies, managing billions of dollars focused on eliminating the world's greatest diseases, the world's worst diseases, and strengthening the health systems of global populations. No small ambition. For over 35 years, Dr. Ross has worked to strengthen the information systems throughout the globe for public health. This includes his prior role as founding director of the CDC's first national initiative to improve our information infrastructure for areas like reporting public health outbreaks, managing vaccine supplies, and modernizing public health laboratories. Under Dr. Ross's leadership, the task force continues to collaborate closely with the CDC in the battle against COVID. And so Dr. Ross brings a particularly unique and helpful perspective in introducing today's featured speaker. So Dr. Ross, I will welcome you to the screen. Thank you so much for being with us today, and I will turn it over to you.
Thank you very much, Madam Chairman, or Madam President. It's my honor today to facilitate a discussion with CDC Director Dr. Rochelle Walensky. Thanks very much to Rotary, all of you, for encouraging this presentation. Of course, Dr. Walensky is incredibly busy, and we're fortunate that she was willing to devote time with us. But let me say a few words about the Task Force for Global Health for my Rotary colleagues who aren't familiar with us. Like CDC, we're based here in Atlanta. We were founded almost 40 years ago by former CDC Director Dr. Bill Foege. And Bill is the guy who led the world's campaign to eradicate smallpox. No small effort. We work with partners in over 150 countries to advance health equity, with a particular focus on eliminating diseases, increasing access to vaccines, and strengthening health systems. The task force and CDC have been partners for a long time, as has CDC been partners with other major nonprofits, Global Health, and others here in the Atlanta area. I'd like to make a point for all of us to remember that Atlanta really is the hub of global health, combined with partners like Emory University, CARE, the Carter Center, major teaching and research academic centers like Morehouse School of Medicine, Georgia Tech, Georgia State, and University of Georgia, and supported by important undergraduate colleges like Agnes Scott, Spelman, Morehouse College, and Georgia State. All of this together makes Atlanta a unique and very important part of helping people throughout the world and the United States to improve their health. So before I introduce Dr. Walensky, I do want to say a few words about the scope and impact of our work at the task force and our work with CDC particularly. Currently, CDC and the task force are partnering on nearly $90 million worth of programs. I'll take a few minutes to give you some examples, as it will help provide sort of the context for Dr. Walensky's presentation and then the discussion we will have afterward. So first, of course, we must talk COVID. In partnership with CDC, we're working with nearly 40 low and middle income countries to increase COVID vaccination coverage. You probably know that there is a huge disparity in vaccination rates between people living in wealthy countries as opposed to those in poorer countries. In fact, while about 62% of the wealthier world population has received at least one dose of COVID-19 vaccine, only 12% of people in low-income countries have. Our COVID partnership with CDC allows us to work with countries in Eastern Europe, Asia, Africa, and Central America to help these people get access to vaccines, but most importantly is to get shots in arms. On the broader public health front, we also assist in training field epidemiologists, people you might call disease detectives. This network of training programs, it's called the Training Program in Epidemiology and Public Health Interventions, works with epidemiologists and laboratorians in more than 100 countries to improve country-driven response to disease outbreaks. More than 20,000 field epidemiologists have been trained through this network, and these field epidemiologists are playing a key role during this pandemic. The CDC Task Force Partnership is also supporting Dr. Walensky and the Biden administration's Data Modernization Initiative. One example is the U.S. Immunization Information Systems that makes it possible for health providers, be that your child's pediatrician, or when you go to CVS or to any other pharmacy, to be able to get accurate information on you and your immunization history. So every state now has a fully functioning immunization information system that supports and provides supports providers of immunization services. So simply put, the U.S. public health system needs to catch up with the times when it comes to data and information systems. States need help building effective and efficient and interoperable systems, such that data needed to support local health decisions, state level decisions, or national decisions can be at our fingertips. Of course, we have the technology to make that possible. What we have to do is invest in the public health system. And I'm proud to say Dr. Walensky's data modernization initiative is a really important step in that direction. Also, CDC and the task force partner on the polio eradication. Welcome our new member. Faye, this is wonderful that you've been involved with that at Gates. We also are. The task force supports strengthening global polio surveillance and vaccination efforts. We help control countries sustain their ongoing polio immunization programs, and we support containment of vaccine-derived polio cases. We're, of course, very, very pleased that Rotary has been an important partner through the polio eradication efforts. As you see, we've got a lot of good work going on, and we can talk about that. But now it's my pleasure to introduce Dr. Rochelle Walensky. She is the 19th director of the CDC, taking the helm 1 year ago. This is one very brave woman. She took over CDC at the most challenging time in my lifetime. She's an undergraduate from Washington University in St. Louis. She received her MD at the Johns Hopkins University School of Medicine, where she trained in internal medicine and then earned her master's degree in public health at Harvard School of Public Health. Dr. Walensky, as a Hopkins grad myself, I won't hold it against you that you got your MPH at Harvard rather than Hopkins. In 2017, Dr. Walensky became the first female chief of infectious diseases at Mass General, where she served as the chief of the Division of Infectious Diseases at the Mass General Hospital from 2017 to 2020, and professor of medicine at Harvard Medical School. She has served on the front line of the COVID-19 pandemic and conducted research on vaccine delivery and strategies to reach the underserved communities. Her work as COVID-19 consultant for both the mayor of Boston and the state of Massachusetts brought her to attention of President Biden's transition team, and which very quickly led to them appointing her as one of the first political appointees in the new administration. So in addition to being an influential scholar and doing pioneering research that helped advance national and global response to the HIV/AIDS epidemic, Dr. Walensky has held a number of important leadership roles in the HIV and AIDS programs, and has advised both the WHO and the joint United Nations program on HIV and AIDS. So before I turn this over to you, Dr. Walensky, I just want to say that to give a sense of how difficult and how big your job is, I want to start the discussion by sharing two quotes from the January Time magazine article about you. Our friend Tom Frieden, who ran CDC, who was CDC director from 2009 to 2017, said this about the role. He said, "It was overwhelming. No matter how hard I worked, how many hours I worked, and how efficiently I worked, I just couldn't keep up with the combination of demands from the White House and the Department of Health and Human Services and the media and the constantly changing information and diversity of healthcare systems in the US." And that was in a much less, enormously less challenging situation. Dr. Rich Besser, who was CDC director in 2009, said this: "I can't think of a more formidable challenge than stepping into the helm of CDC in the midst of a pandemic in a setting where you are working totally remotely. This is absolutely an unbelievable challenge." So, Dr. Walensky, you are indeed a very brave woman. And I want to thank you for taking on this challenge. You are doing a wonderful job on behalf of the nation and the world. So with that, let me turn it over to you.
Thank you so much. What a lovely introduction. Thank you for inviting me here. I am, of course, honored to speak with Atlanta Rotary, a group that's been recognized who wholly recognizes what we recognize here at CDC, and that is that we cannot be healthy as a nation here until all nations and all people are healthy. I want to acknowledge really the critically important role Rotary International has played in the eradication of polio. I am deeply grateful for that partnership, and while all of our work in COVID is ongoing, our work in polio continues to be ongoing, although it's getting less attention. CDC partners with Rotary on many public health efforts around the world, as Dr. Ross, you just described many, including the provision of basic health services and access to clean water and to sanitation. CDC and Rotary collaborate in India, Nigeria, and South Africa, along with ministries of health and partners like USAID on Rotary Family Health Days. During these campaigns, we work together to increase childhood immunizations, prevent HIV and AIDS, and screen for cervical cancer. Other projects include providing deworming for children, distributing mosquito bed nets, and the provision of other healthcare services like blood pressure screening and eye exams for cataracts. So how did we end up in Atlanta? What is CDC's connection to Atlanta? Well, CDC's headquarters are near Emory University, and that traces back to the outbreak of malaria, as well as to the former Coca-Cola president, Robert Woodruff. In 1942, the United States Public Health Service set up a program called the Malaria Control in War Areas to prevent the spread of malaria. And since many military training bases were in the South, Atlanta was chosen as its headquarters. So in 1946, the United States Public Health Service established the Communicable Disease Center, or then CDC, and first adapted the CDC acronym. Robert Woodruff was instrumental in persuading Emory to sell 15 acres of land, which brought CDC's campus to Clifton Road. Fast forward to today, CDC is ranked one of Atlanta's top 15 employers. If CDC were a public company, annual operating budget would rank 107th on the Fortune 500 list, placing it among the top 5 largest companies here in Georgia. So now that we are here, what is it that we do? You all know us to do COVID, but CDC has in fact worked 24/7 to protect America from health, safety, and security threats, both foreign and in the United States. Whether diseases start at home or abroad, whether diseases are chronic or acute, curable or preventable, human error or deliberate attack, CDC fights disease and supports communities and citizens to do the same, 24/7. CDC increases the health security of our nation. As the nation's health protection agency, CDC saves lives and protects people from health threats. And to accomplish our mission, CDC conducts critical science and provides health information that protects our nation against expensive and dangerous health threats and responds when these threats arise. Our global programs are critical. They're run by world experts in epidemiology, surveillance, informatics, laboratory systems, and other essential disciplines, and provides a strong global health leadership capacity. The work of these experts internationally strengthens critical public health services both here and around the world. CDC engages foreign governments to help address their health challenges, which support the interests of the American people. In addition to providing health benefits, the collaborations often serve as entry points for broader diplomatic engagement, making CDC's global work critical. Our global programs address more than 400 diseases, health threats, and conditions that are major causes of death, disease, and disability. CDC works in more than 60 countries with staff from the United States, but even more staff from their respective countries to carry on the work, working with ministries of health and other partners on the front lines wherever any outbreak occurs. In 2021 alone, CDC's Global Rapid Response Team deployed 400 staff to 5 countries and 24 states and territories on 694 assignments. Operations Allies Welcome, the Haiti earthquake response, the Uganda Marburg hemorrhagic fever investigation, CDC's polio response, and the Ebola response in Cote d'Ivoire, Democratic Republic of Congo, Guinea, Liberia, Sierra Leone, and Uganda. CDC established the first field epidemiology training program outside of North America in Thailand in 1980. Between 1980 and 2020, 40 years, CDC helped train more than 18,000 disease detectives. You just heard Dr. Ross talk about them in over 80 countries through flagship global field epidemiology training programs. So speaking of disease, we know that disease knows no borders. Where are we in COVID and what are we going to see moving forward? We all share the same goal, to get to a point where COVID is no longer disrupting our daily lives, a time when it won't be a constant crisis, rather than something we can prevent, something we can protect against, and something we can treat. Of course, now Omicron cases, we are happy to see, are declining, and we are all cautiously optimistic about the trajectory we are on. Things are moving in the right direction, but we want to remain vigilant. We have to remain vigilant and to do everything that we can so that this trajectory continues. So in terms of where we are, our 7-day daily average of cases is at about 68,000 per day. Our 7-day average of hospitalizations is about 5,000 per day. And still our 7-day average of daily deaths is about 1,700 a day. Friday, we released a new framework for COVID-19 community levels that uses data on hospitalizations, hospital capacity, and cases to determine the level of transmission risk in a community. This new approach focuses on preventing hospitals and healthcare systems from being overwhelmed and on directing preventive services and efforts towards protecting people at high risk of severe illness. This new COVID-19 community level will guide CDC recommendations on prevention measures like masking and testing. We as a nation are, and I should mention, you can find your community, your county level at www.cdc.gov, just on our homepage. We're in a stronger place now as a nation when it comes to protecting our communities and ourselves against severe disease because of all of these efforts, like vaccinations, improvements in testing, wearing high quality masks, and improvements in ventilation. And because living with this virus for 2 years. The overall risk of disease is now generally lower, and yet still the virus will continue to circulate in our communities. So these COVID-19 community levels can help inform public health guidance at the state and local level and provide individuals an understanding of what precautions they may want to take based on the level of disease burden in their community, based on their underlying risk, and also, of course, their own risk tolerance. There will still be people out there who are at higher risk, or those who live with people who are at high risk, for whom COVID-19 will want to take extra precautions regardless of their own community status. And so going forward, we'll be able to dial up and dial down our recommendations based on the level of COVID-19 in a community and specifically the strain on healthcare. We know that pandemics are unpredictable. We've certainly learned that this last 2 years, and this virus is wily and has humbled us at many times. The state of the pandemic is not uniform. What the pandemic looks like here in Atlanta is different from what it looks like in South Bend or in Navajo Nation. Vaccine uptake is different across the country and across racial and ethnic groups. Endemic may mean it turns up in seasonal coronavirus that causes respiratory illness like a cold or flu. We don't isolate or quarantine for flu with kids in classrooms. So will we continue to wear masks in public? Will we ever be taking off our masks in our hospitals? Decisions have to be guided here by science, and we still have a lot more science to do and a lot more to learn. There will not be a one-size-fits-all scenario, and yet we recognize that's exactly what people want. But for example, if we want to have isolation and quarantine guidance that was quick and easy to understand, we'd say everybody just stay home for 10 days no matter what. We can make that easy, but it's often more stringent than necessary. And once we start talking about settings, risks, backgrounds, that discussion, that science gets more complicated. It gets more confusing. It gets more lengthy. We have science and data to support more tailored recommendations, and we share that so people can make the choice that's right for them and for their own situation. But we need more voices. We need your voices. We're so grateful for your voices out there sharing accurate public health messages. So how do we get to the next stage? Well, we need long-term sustainable investments that address the deficits in the public health system that we saw at the beginning of this pandemic that Dr. Ross just commented on. And we need to address the broader public health consequences of the COVID-19 pandemic. This pandemic has laid bare major gaps resulting from decade-long erosion in workforce support. In the 10 years before COVID, when we had Zika and Ebola and H1N1, and then finally COVID-19, there were over 60,000 public health jobs that were cut and thousands more preparing for retirement. 25% of CDC staff are retirement eligible. In fiscal year 2019, CDC met 50% of state and local health departments' stated needs for epidemiology and laboratory capacity funding. Recognizing that the heart of the public health system in its work is its workforce, we must bolster that workforce. We need to strengthen our public health workforce, a workforce that is appropriately trained, that is technically expert, and reflective of the sheer diversity within the communities that they serve. We need to prepare for future public health threats, both global and domestic. We need to strengthen our public health laboratory infrastructure. We need to modernize our data systems. Dr. Ross spoke about that as well. And then we need to address health equity in every single thing that we do. We have to provide stable longitudinal resources that, and I would say disease agnostic resources, that allow public health departments to adequately recruit, compensate, and retain their really robust public health workforce. And the funding must be across all diseases. It can't be that if you have funding for sickle cell, you can't use it for, or I should say funding for sexually transmitted diseases, you can't use those skilled contact tracers to then leverage for contact tracing for COVID. Despite focus on COVID, CDC is not ignoring critical work we must do in areas like prevention of firearm violence, ending the HIV epidemic, and addressing disparities in maternal mortality, chronic diseases, mental health, and opioid use. All of this work actively continues. I spoke a little bit about health equity, but I want to speak more. We have a chance now to build a stronger, more resilient public health system and make sure that health equity informs everything that we do. Racial and ethnic disparities have been with us for centuries, through generations of Americans. We have higher rates of chronic disease, like diabetes, hypertension, obesity, asthma, heart disease in some racial and ethnic minority groups. We've seen increased risk for HIV or maternal mortality in Black and Hispanic or Latino communities. We've seen smoking and substance use rates in LGBTQ communities and in rural communities across the country. We've seen a disproportionate impact of climate change on racial and ethnic minority communities. And we saw a massive life expectancy loss for Black and Hispanic communities, especially during the COVID-19 pandemic. As we said at the top, no nation can be truly safe until all nations have core public health capabilities and health systems in place to protect the most vulnerable. We need to be deliberate, we need to be evidence-based, and we need sustained efforts to address systemic factors that disproportionately impact so very many. We must understand the culture of the communities we serve and to bring culturally appropriate services to them. Equity remains and requires respecting our diversity as human beings, making sure our actions and our solutions are appropriate and take into account all of the needs of others. So what can we do to help? Well, we have many public health issues that have worsened during the pandemic. We have record high levels of obesity and of tobacco use. We have increasing rates of HIV and other sexually transmitted diseases. We have worrying trends in rates of firearm violence and suicidality. We have growing impact of climate change. We've seen increases in opioid-related deaths, and still on the front lines, preventing and responding to these are many, many public health challenges and public health issues. CDC can't tackle these issues and strengthen public health infrastructure alone. This is going to be a team sport, and we so badly need your help. You can help by working to ensure that our public health infrastructure is equipped with needed resources. This is pivotal to ending not only the pandemic, but also to preventing future ones. You can be a conduit to access and public health information. As influential leaders, you are seen as trusted messengers. People will not want to listen potentially to me, but they will listen to you. Lean in on public health and continue working within your spheres of influence to get as many people vaccinated against COVID-19 as you can. And please help us share accurate information. So with that, I want to again say thank you, and I'll turn it back over to you, Dr. Ross.
Oh, thank you, Dr. Walensky. Wonderful, wonderful talk. I think I should begin where you ended. I was going to close today's session with asking you about what Rotarians could do to help. I think you've answered that question. So thank you. Since we've got you, and we just have a few minutes here, but you said something that just is spot on true to me, and that is that public health is basically a team sport. A lot of people have a vague notion that somehow or other CDC is in charge of all public health. But yet in the United States, we are organized at the state level. And depending on the state, some are organized centrally, some are distributed down, even to county commissioners have all the authority. So this very curious approach to public health practice, the way we do it in the US, I think has probably challenged you and all of our colleagues at CDC with how to communicate about a pandemic. I'm just curious what your thoughts are about, and sort of as you look back, I mean, you've been actively in the mix, running 100 miles an hour for a year, but what kind of thoughts you have about how we help the country understand the dynamic of an epidemic itself by its nature? Things change constantly, and communicate that through this very distributed public health leadership, the situation we have.
Yeah, that is just such a great question, especially in this moment. So we at CDC get data from, of course, the 50 states and 3,000 more jurisdictions.
Yeah.
All of those data come in. They are not uniformly reported. In fact, not every jurisdiction or every state actually collects the same data. They may collect it in a different form. And then we at CDC need individual data use agreements with all of these jurisdictions and their reporting. So the complexity of the fact that CDC doesn't actually have the authorities to convey this information back to us, we rely on the partnership of the states, which is great because we have great partnerships with the state. But as you can imagine, when we don't have uniform data collection or even uniform surveillance, and then we have individual data use agreements, it becomes hard to be the sort of compiler and to put it all together. You layer on that we're in public health, but in fact, our health systems don't talk to each other. Our public health and hospitals don't necessarily talk to one another. So one of the big gifts that we've been working on through this pandemic is electronic laboratory reporting, electronic case reporting, so that we can actually have some of these communications, have the pipes connect essentially. And that's really a lot of the efforts of our data modernization. It's been pedal to the metal, quite honestly, for the entire pandemic, and we've made huge strides, but it's also opened the doors of all the things we can and need to do in order to do better. So this is going to not just be a massive investment in our infrastructure at the data level, at the public health level, but also shape how our authorities at CDC, we've been hit for how come you don't report vaccination rates in people who are hospitalized. And the truth is we don't have any authority to collect those data. We have no statutory authority. So we rely on the partnerships of our state and jurisdictional partners to report those data to us. Maybe one other point that I will make with regard to your comment about communication to the American public. This has just been so complex, such a complex time. I think when we say we're going to lead with the science, that the implication to everyone is that the science would be black and white. And it turns out science is in black and white, and science is gray. And so much of scientific discussion that would happen in a scientific meeting with scientists rolling up their sleeves and having a robust discussion about what a new data point shows is now playing out on the nightly news.
Yeah.
And when that happens, it's hard for the public to digest. How do I make a decision about the right thing to do in this moment of gray? And there have been so many moments of gray because we've had numerous different surges, numerous different variants, vaccine effectiveness, vaccine efficacy, clinical trials. So there have been a lot of moments of gray, and they're playing out on primetime news.
Yeah, it's very well said. And I think so much has changed with our media environment, with both the incredible reach of social media, coupled with the proliferation of news channels everywhere all the time. I was at CDC in what now can only be described as the good old days when it was easy. Where we only had a few nightly news channels and all to deal with, and our press office met every Thursday and gave the press people some basic news about what was going on, and it's radically changed. And as you point out, with public health being a discipline that is where science meets policy, it isn't just scientifically we sit down and hash over some data and look at a phenomenon and argue amongst ourselves. It's now then taking that message to policymakers, many of whom, in fact, the vast majority, I think, have no experience with this. So that's a challenge, right?
Yeah.
Any thoughts about it as you've come into your 1 year into the job? We should give you a 1 year ribbon, I think. Not really. I used to work for a company that if you survive 2 years, they put a red badge on your badge that you had the red badge of courage. We need that for you. But I think dealing with that policy environment, you are back and forth all over the place. I'm sure spending lots of time at HHS and maybe at the White House. How has that been for you? How are you surviving it all?
I feel my job is to look at the science, the ever evolving science, and the science that now doesn't play out in journals, but in medRxiv, right?
Yeah.
The discussion that is occurring internationally, because we often will see some data from another country before we see it in our own. So so we take all of that science. We have to make our guidances that reflect that science. confirm that science, right? We don't want to act on the first signal because we need to make sure that it would be confirmed. We need to make our guidance reflective of epidemiology. What are the trends of disease, right? And then we need it to be implementable. Because what we don't want to do is put guidance out that's ignored. It's got to be feasible and implementable. And what's interesting about it in that sort of at the intersection of those 3 points is we also have to do it so that it is relevant for Manhattan and rural Montana and Navajo Nation
Yep.
and Alaska. So I'll give you a pure example. When we rolled out our new guidance on Friday, we had a lot of people who were really interested in using wastewater as a signal. And we've been scaling up our wastewater surveillance, and I'm really excited about the potential for that, not just for COVID, but for many other infectious diseases and antimicrobial resistance. We have 400 sites that are representing about 53 million Americans, and we anticipate that we're going to double that actually in the next 4 weeks, which is great. Wastewater doesn't work for Alaska. They're on septic tanks.
Right.
And so we can't have guidance that reflects you need to look at your wastewater. We can say locally, if you have wastewater, please use that too. But we do need to. So it's that, we have so many collaborations with each jurisdiction, and we reach out to them frequently so that we can make those policy recommendations.
I've got a few questions here coming in from our audience, and if you would give me just 1 second to try to, I'm wrapped in listening to you, but trying to look over
Of course.
So Catherine Kelly asked the question. I'd like to ask a final question at the very end when we come back on. She just so a heads up here. She's got a question for you, but I'll let her ask that. So here's one from Bill Hennigan. How do you view the turnover of healthcare workers affecting public health over the next few years?
I think we've had turnovers in healthcare and we've had turnovers in public health. And I think that is going to be a challenge because that is something we need to train up and skill up, and not something we can buy with immediate resources, right? So if we had money tomorrow, and we've gotten a lot of resources through COVID packages, I'm really grateful to Congress for that. But that's really where I talk about longitudinal investments, because we need to talk to medical students, nursing students, public health students today, encourage them. And in fact, how encouraging is it that applications are up for all of those,
Yep.
right? And encourage them to continue their training into this field. But that's the upskilling that we need to do, and it takes some time to do it. If 25% of CDC employees are eligible to retire, we have to make sure that there is a pipeline, a really robust pipeline, of people here at CDC and across the nation in both public health and healthcare. And so many people in healthcare actually bridge to public health. I'm among them. So I think that this is really critical. One of the things I have said is, and I've talked to our team about this is, as we think about how med school applications, nursing school applications, all these applications are up, there are going to be some people who are rejected from those pools. What do we do to continue them in fields and not discourage them, so that they can continue in fields of health and public health? How do we engage with them? One of the questions that, one of the things I've always said, and I'm a big believer in community health workers. When I was a clinician at Mass General, we used to have a great cohort of community health workers that would go find our patients when they were lost to follow up, really trusted people in the community. And I have frequently said, if we had community health workers in every church who was doing hypertension control and nutrition counseling and diabetes control, it might not have been so hard to mobilize that community, that church, to get vaccinated.
Yep.
There would have been people there to who they had trusted already.
Well, trust is the key word. You're right, and it's all about building community trust. I think before we bring on Catherine to ask her question, I just comment. I have my oldest daughter is an intensive care nurse at Georgetown Hospital DC in neurology, but over the last few years, it's as though the stroke patients disappeared and the brain surgeries disappeared. And so it tells us that as we start to look at the data over the coming few years, we're going to also see a different kind of morbidity and mortality impact in our health statistics. On the upside, I do want to say there is some optimism on the workforce. I am a trustee at Agnes Scott College, and much to my surprise, public health is one of their biggest undergraduate programs. So there are a lot of young people who want to jump in and be a part of the team sport. So that's optimistic for the future. With that, I know our time is running close. Should Catherine come back on?
Great. Thank you so much. Dr. Walensky, wonderful to meet you. And thank you both so much. It's a fantastic conversation. My question is thinking about your work pre-COVID, pre-CDC, what would be one lesson you've learned during that prior chapter that's been especially helpful as you're navigating everything these days in the middle of COVID?
The thing that I think really has stuck with me through my career in HIV research and HIV care has been the inequities. And I do really believe the COVID shined a light on those inequities for all of the world, but infectious diseases, I mean, when you think about COVID here, it came on our shores from people who traveled on airplanes and people who traveled on cruises. And it then rapidly went to places where people had no resources. And that is true of all infectious diseases or most infectious diseases. And so I do hope we take this moment and use it to leverage efforts to make sure that we don't have inequities in healthcare. And so I'm working very hard to do that at CDC. In April of 2020, we declared racism a serious public health threat. That was April of 2021. That was just about 10 weeks after I got here. And more than 200 health departments around the nation have done the same. So I'm really hopeful that we can take this moment, this light that was shined, and deliver healthcare equitably across this nation and across the world.
Could I say also, thank you for bringing that so much to light, because it is a desperately needed attention in our country. But also let my fellow Rotarians know that at the task force, we have a program called the Focus Area on Compassion and Ethics, where we look at very carefully at all these disparities. Anybody who wants to raise their hand and get involved, happy to have them involved. And we are very proud, Dr. Walensky, to be partnered with CDC to help bring COVID vaccines to all of the people around the world, because until everyone's vaccinated, no one's safe, and we could have more variants and it could all cycle back. So we will keep up the march, and we're proud to be able to work closely with you. And thank you for all you have done to advance health around the world.
We too are grateful for your partnership. Thank you so much for the opportunity to be with you today.
Yeah, thank you. Thank you both. And I love your earlier analogy about the team sport, because Rotary in the same way is so grateful to be on the team with both of you. And just want to thank you again for your time. Dr. Walensky, I know you've got the world on your shoulders, and we admire your courage and wish you nothing but the best in all that you're doing. And of course, the same with you, Dave, and all that you're doing. Really appreciate your time being with us today. Thank you.
Thank you very much.
Yes, thank you, Dr. Walensky.
Great. Well, thank you. What a special program. And I have to say, on a personal note, when I first jumped into this seat, one of the very first people that I thought of, in fact, the very first person that I wanted to bring to join us at Rotary was Dr. Walensky. So it's a personal honor to have her with us today. Next week, again, we'll be back in person. Please join us. I'm so excited to see everyone again. It's going to be great, and we're off to a great spring. So we will look forward to that, and have a wonderful week. See you then. Bye-bye.